What's up everybody, my name is Pedro Cândido and today I'm here to teach you a little bit about the acid-base disorders, okay? This will be a full course here at Med Knowledge, okay? So this will be an introduction class, okay? So we'll talk a little bit about the basics so we can get going with the topic, okay? So before we start, I would like to ask you to subscribe at our YouTube channel. We are just starting, okay? Please give a like and that will help us a lot. To distribute this free knowledge that this is our mission here at Med Knowledge, okay? Our contents are free for everybody, okay? Soon we'll have a website, so you can go there and have all of our contents very organized, okay? So let's start. First of all, we're going to talk about the arterial gasometry, okay? That is the exam, so we can have the data that we need, okay? To talk about the pH of the blood and etc. Okay, so as known as arterial blood gas. Okay, so first of all, let's talk about the pH of the blood. We need to maintain a constant pH so we can have the cell function going all right. Okay, if we have changes in the pH, we'll start to have some troubles. So first of all, what is pH? pH it's nothing else that the concentration of the proton H+, okay, the hydrogen in our blood. So the normal concentration will be between 38 to 42 nanomoles per liter, okay? So, but in order to have a more simple number, okay, we transform this into a logarithmic scale, okay? So the pH will be equal to minus log of the concentration of H+. Okay, so we'll end up with this number right here, okay, guys? That will be 7.35 and to 7.45. This will be the normal pH in the blood, okay? So let's start talk about what happens when these numbers start to change, okay? So we'll start to have some so the cell function will start to change, okay? So the cell function will start to change, okay? Here I gave a little bit of an examples that will some functions that will actually change when there's a high pH or a low pH, okay? So first of all, the hemoglobin dissociation curve, okay? When we have a low pH, the hemoglobin will start to lose its affinity with the oxygen. So the oxygen transportation in the blood. The calcium metabolism will also suffer with changes in pH. So when we have a higher pH, the calcium with the blood will start to bind more with the albumin, okay? In normal circumstances, there will be a 50% ratio between these two compartments, as we can say. Okay, the free calcium in the blood will be 50%, and the calcium binded to the albumin will also be 50%. So with the higher pH, we will start to change this ratio, okay? We'll have more calcium binded with albumin, so we end up with the hypokalemia, okay, in the blood. Another function change that we'll have in circumstances with a low pH. Okay, another example of a loss of cell function due to changes in pH will be in the heart, okay? We'll have a lower cardiac output, okay? But why we'll have a lower cardiac output, Pedro? It's right here. We'll have less beta receptors due to a decrease in the pH, okay, guys? And how this will happen? Let me give a zoom here so I can draw better for you. Okay, here we have a cell heart, okay? And in the surface, we will have a lot of beta receptors, okay? Okay, so if the pH goes down, there will be a process of endocytosis of these receptors, okay? So all the receptors will go inside the cell and they won't be able to do their function, okay? the adrenaline, epinephrine won't be able to bind to these receptors and stimulate the heart, okay? And what if we have a lower cardiac output? What this will will bring it to the hemodynamic balance in the body, okay? Remember that blood pressure is equal to the cardiac output, okay? Okay, so remembering that blood pressure is equal to the cardiac output times the peripheral vascular resistance. Okay, so if you have a lower cardiac output, we'll end up with a lower blood pressure. So if you have a very high alkalosis, this can end up in a cardiogenic shock, okay? So continue with our topic about the pH. This is the representation of the Henderson-Hasselbalch equation right here. That simplifies for us doctors what we really need to understand about the bicarb and the PCO2 numbers, okay? As you can see through this equation, as you can see through this equation, we will end up to some disorders that will alter the pH, okay? So let's give some examples that you understand very much better, okay? If the PCO2 goes down, what will happen to the pH? So if the PCO2 goes down, like in the equation, you'll have a higher pH, okay? Okay, PCO2 goes down, we have a higher pH. And if the PCO2 goes up, we'll end up with a lower pH. Okay, so now we can analyze the bicarb. Oops. Okay, if the bicarb goes down, we'll have a lower pH also. If the bicarb goes up, we'll have a higher pH. So what's the difference between these situations, Pedro? When we have alterations in the PCO2, we'll call that respiratory alterations, okay? And the alterations in the bicarb, we'll call them metabolic alterations, okay? But Pedro, let's give it a bit more classification, okay? When the PCO2 goes down here and the pH goes up, we end up with a respiratory alkalosis. Okay, and if the PCO2 goes up and the pH goes down, we end up with a respiratory acidosis. Okay, and the same thing for bicarb. Okay, if we have a low pH, we'll have we'll end up with a metabolic acidosis. And if the bicarb goes up, the pH goes up, we end up with metabolic alkalosis. Okay, guys, so let's make some questions that will give us a bit more practice, okay? So you are on a shift in the ICU and check the arterial blood gas of your patient, which shows the following result. Okay, let's analyze the results. We'll have a pH of 7.37. Okay, so the pH normal values goes from 7.35 to 7.45. Okay, so this is normal pH. Okay, so there's no alkalosis, neither an acidosis. Okay, the PCO2, it's normal. Okay, it's 82. PCO2, let's remember the values. It's 35 to 45. So also normal. What about the bicarb? Bicarb, but normal values goes from 22 to 26. Okay, so 23 also normal. So this result corresponds to a normal exam, guys. Okay, there is nothing wrong here. So let's go to another question. Okay, observe the arterial blood gas and select the correct option. Okay, we have a pH of 7.26. Okay, so now we have acidosis, sorry, because we have a lower pH. PCO2 31, also a low PCO2. And the bicarb is lower also. So let's analyze our options. Okay, we have a metabolic acidosis, metabolic alkalosis, respiratory. So let's analyze our options. Okay, we have a metabolic acidosis, metabolic alkalosis, respiratory acidosis, and mixed acidosis. That will be a topic of another class. But if we have a lower bicarb, we can already say that this is a metabolic acidosis. If you remember here, lower bicarb, lower the pH, so metabolic acidosis. But Pedro, the PCO2 is also changed here. Why can I say that this is due to a respiratory issue? Because if this acidosis was caused by the PCO2, we would need a higher PCO2, not a lower PCO2, okay? So we end up with this answer, okay? Metabolic acidosis, letter A, guys. Okay, so this is our first class. I hope you all enjoyed, and don't forget to leave the like, subscribe to our channel, that the full course of acid-base disturbs will come soon. Okay, thank you guys, see you soon.